Good morning, ladies and gentlemen. I want to welcome you to our lecture 11 in the series of Occupational Health and Safety on our program, which is Environmental Health and Safety. Now, if you recall, ladies and gentlemen, last week we covered lecture 9 and lecture 10 in the previous 2 weeks, lecture 9 and lecture 10. And with lecture 9 and lecture 10, we covered topic number 4, which was responsible and ethical business practices and their synergies with health, safety, and well-being. Now, that topic was divided into 2, if you recall. In lecture 9, we covered introduction, understanding responsible business practices. We also covered the changing role of business in society. Now, again, in lecture 10, I did give you a recap of those aspects of responsible business practices and the changing role in business. But we straight away went into standards and instruments for promoting and implementing responsible business practices, and we also discussed the different contexts, different business responsibility and sustainability priorities, which was our topic 9 on the course outline. And then we did attempt to relate responsible business practices to health, safety, and well-being, and then thereafter we concluded our topic. Today, ladies and gentlemen, I want to welcome you to lecture 11. And lecture 11 is going to handle our topic number 5. And this topic number 5 is called Aligning Perspectives and Promoting Sustainability. However, on the course outline that you have, this is referred to as topic 10. The reason why these topics have been reduced to around 5 is because some of the things have been integrated in topic 1, in topic 2, topic 3, topic 4, and topic 5. So there was no need for us to look at them as different topics. However, remember, this is our lecture 11. So for every topic, we have had more or less 2 lectures. Therefore, today, our topic 5 will examine how organizations and how national states, for instance, can align perspectives and promote sustainability. So in this lecture, ladies and gentlemen, I will give you an introduction. Thereafter, I will introduce you to synergies that can be enhanced in policy and practice. And of course, here I will present the case for developing integrated and holistic approaches. And for some of you who have been listening to me attentively, you will discover that for every topic that I've been covering, I have been discussing the perspective of developing an integrated and holistic approach or approaches, program or programs. Then from there, I'll proceed and discuss how organizations and nations can align perspectives and mainstream health, safety, and well-being in organizations. So it's the responsibility of government, but also responsibility of the boards and the shareholders to align perspectives and mainstream health, safety, and well-being at the organizational level. Ladies and gentlemen, from there I'll continue with aligning perspectives and mainstreaming health, safety, and well-being at the societal level. Remember, we start with the practice. 2, we look at the organizations. 3, we proceed to the societal level. And then, ladies and gentlemen, later on, we'll be looking at actions needed for aligning perspectives and mainstreaming health, safety, and well-being. And then I'll be giving you future directions, and then I'll conclude. Again, as I said, I do not think I'll be able to cover all these 6 components in this lecture, but I'll cover half of that, and then in the next lecture, we'll certainly proceed and conclude our topic. Ladies and gentlemen, in a way of introducing this course, we have already seen in the previous lectures the concept of health, the concept of safety, and the concept of well-being. I'm sure you now know what we are talking about. But we have also discovered that these concepts of health, well-being, and safety are at the core of the workplace. You may also have discovered these concepts of health, safety, and well-being. They are at the core of societal functioning and development. And that's why we discuss health, safety, and well-being at the organization and at the societal level, and of course what is required to be done in future. Now, ladies and gentlemen, I want to remind you that it is essential that perspectives to management of health, safety, and well-being must be aligned if progress is to be achieved in a sustainable way. And that's why we talk about sustainability and responsible business. But I should also bring to your attention that for every individual to be provided with a working environment that is safe, a working environment that does not harm their physical or mental health, is an essential part of the employers as well as the state's responsibility. It is the responsibility of the state and responsibility of the employer to ensure that organizations do provide safe and a physical environment that promotes the well-being and the safety of the employees. That's the responsibility of the organization and responsibility of the states or governments. Now, the state is responsible for the design, implementation, and enforcement of health, safety, and well-being regulations and policies. Now, ladies and gentlemen, since you are studying this concept from our environment here, let me give you an example. For example, Uganda has an Occupational Safety and Health Act, 2006. And I want to invite you to go and download that Occupational Safety and Health Act of 2006. Now, just to cite something from that act, in accordance with Section 13 of Occupational Safety and Health Act 2006, it is obligatory for an employer to ensure health, safety, and welfare of persons at the workplace. That's what the Occupational Safety and Health Act says, Section 13. And employers must know that very well. The same Section 13 articulates and says it is obligatory for an employer to ensure provision and maintenance of workplace which is adequate regarding facilities and arrangements for the welfare of the workers. Therefore, provide facilities. It is unfair and unacceptable for you to give somebody a job and you do not provide an environment and facilities that will enable him to perform and function at maximum productivity. So the Act, the Occupational Safety and Health Act, talks about those things very well. Ladies and gentlemen, we also know that health, safety, and well-being in the workplace should be a priority for organizations, a priority for organizations, for individuals, and society. And therefore, in this lecture, we outline the current state of the art. In this lecture, we also highlight key perspectives and approaches in this area, and we reiterate the importance of long-term view towards sustainability. In this lecture, we also discuss issues of interdisciplinarity and complementarity of different perspectives and synergies that are supposed to be enhanced by the employers, by the states, and the responsibilities of individuals or employees at the workplace. So it is therefore important and contingent upon the employers and the nation state to ensure that this concept of interdisciplinarity is promoted. Because you can't understand the issue of sustainable business and issues of sustainability without knowing that there must be interdisciplinary approaches, right? Because if you take sustainability issues alone, or environment, health, and safety, then the employer will not understand, because the employer only understands strategic moves which will enable him to achieve results or profitability at the end of the day. Right, let's go to synergies that can be enhanced in policy and practice. And here we are looking at the case for developing an integrated and holistic approaches. Now, ladies and gentlemen, when we talk about issues of health, safety, and well-being, I did tell you at some stage, I think it was our lecture 2 and lecture 3, that well-being is a summative concept. Well-being is a summative concept that is characterized by the quality of working lives, that is characterized by those key issues that will or enable an employee to function at maximum capacity or capability at the workplace. And we know that is a major determinant of productivity of the employee and the productivity of the organization as a whole. Therefore, maintaining productive workers is an important attribute and objective of organizations. And therefore, organizations must strive as much as possible to maintain productivity of workers. Because at the end of the day, if you want to know how productive your employees have been, then you look at the toolbox and know how much you have been able to bring. But if you have employees who are not, who are sickly, whose health is questionable, they will not function at maximum capacity and capability, ladies and gentlemen. Therefore, it's important for us to recognize those aspects. Now, if I refer you back to some of the documents that we have already presented, for instance, the International Labour Organization report of 2011 and 2013, you will discover that the report articulates the consequences of having a labor force that is not healthy. In fact, that International Labour Organization report of 2011 and 2013, it reports that 2.3 million deaths occur annually across countries for reasons attributed to work. The same document says about 350,000 people or employees and deaths are caused by occupational accidents. So the death of 350,000 people can be attributed to accidents, and these are occupational health accidents. And we also know that the biggest mortality burdens come from work-related diseases, accounting for about 2 million deaths. Of course, I did give these statistics in our lecture 2, lecture 3. I don't want to really spend too much time talking about those statistics, but certainly we know what has been documented, various ailments like cardiovascular and circulatory diseases, which stand at 35%. And of course, you have also a number of other related elements there. So the International Labour Organization report has articulated those things. But I also did tell you the costs of this death to the employers, to families, to the societies, communities, and nation states in terms of GDP, ladies and gentlemen. And I will not really go into that right now. But certainly we know that with the development of the new paradigms that we are talking about, it's very important for us to understand the complexity at the workplace and how these explain employee health and safety and well-being. And certainly how these things do affect health and try to reduce the health-related hazards at the workplace. Therefore, ladies and gentlemen, promoting health, safety, and well-being means understanding the implications of the changes at the workplace and trying to adapt our approaches to be more inclusive. And that's why we need research at that level. It also means moving away from silos, because we are used to silos and monodisciplinary perspectives. And then we strategically align and integrate approaches based on risk management. And when we talk about risk management, we are certainly dealing with prevention and protection. So why should we take a reactive nature and strategies where you wait for individuals to get sick and you start treating them instead of preventing ill health? And that means that we must take on a strategic approach, ladies and gentlemen. And then also promote health, safety, and well-being at the workplace. We must raise awareness and also promote these interventions. Now, interventions to address health, safety, and well-being should involve cooperation between different actors. They should involve focusing not only on individual level factors, but more importantly on organizational factors and the societal factors. And that's why, ladies and gentlemen, only in this way shall we be able to address the concept of health, safety, and well-being. Just to take you to the scholarly works published by Schultz and Vino 2010, they argued that in order to address work well-being or employee well-being and the productivity effectively, then we need to revisit our traditional approaches to occupational health and safety. Then we must expand those traditional approaches to include assessment of factors that lead to probably health, that lead to happiness, that lead to a productive force at the workplace. And of course, while at the same time we adopt a life course perspective where we promote the health, the safety, and well-being of employees. And that means that we must also develop capabilities, ladies and gentlemen, because very few people understand what these concepts are all about. So I know that various regulatory frameworks exist, and those are hard frameworks, and there are those which are soft. They are soft. But at the end of the day, we must understand the hard and soft approaches and be able to come up with perspectives that will improve our understanding of those frameworks. And therefore, ladies and gentlemen, at the organizational level, there is growing recognition that health, safety, and well-being is associated with strategic and often intangible business benefits. And research is published. Research is available. And you just have to go read, pick these things, develop policy documents, and then be able to utilize this information to implement the issues that we are discussing. Today. We also know that we need a holistic approach, and these holistic approaches are very important because of the financial benefits that accrue from them, because of the legal and moral reasons, because of organizations coming up with initiatives that do help countries to implement international conventions and agreements, and of course policies, and of course laws, ladies and gentlemen. So at the national policy, the collaboration between different policy actors then become very crucial and important. And of course, the interdependence between occupational health, safety, and the human resource department and business management also become crucial at the organizational level, ladies and gentlemen. So all these are important components that need our thinking. So how can we then align perspectives and mainstream health, safety, and well-being at the organizational level? Very, very simple. At that organizational level, we must understand work that is implemented or that is undertaken and executed by different employees. Just go and study, and then understand the health, understand the safety, and understand the well-being aspects associated with the functions that individuals are performing at the workplace. In the same way, there must be sharing of information. There must be communication between the experts, the professionals, practitioners, and the key stakeholders, and also policymakers. Just to have these meetings, forums, discussions, conventions, and conferences, and then discuss these issues, and they'll come to the fore. But somebody must take the initiative, ladies and gentlemen. And of course, we know that researchers at the same time must undertake research so that we understand these things. And then we take the integrated approach where, for instance, human resource, finance, and marketing, and so forth, discuss these issues. I know that in many organizations that do promote the functional aspects of departments, the function approach, usually certain departments think that they are more important than other departments. They do not actually sit and discuss issues which are of strategic nature that will enable them to achieve results at the higher level. So that's why it becomes very important for organizations to discuss these things, and we need to mainstream the activities for aligning business and, of course, health, safety, and well-being interests and activities at the workplace. And, of course, mainstreaming is very important for overcoming sub-optimization, and those are the issues I've been talking about, and silos within an organization, and then allow these managers and workers to deal with issues of interdependence and interactions between health, safety, well-being at work, giving them a better overview of the combined health, safety, and well-being concepts and perspectives. Ladies and gentlemen, as I move towards summarizing this lecture 11, I want to bring to your attention the key strategies that have been identified in streamlining health, safety, and well-being. Remember, we are talking about the integration of this component HSW, that is health, safety, and well-being, and the strategic focus of an organization at that level. So now these strategies, I'll just again list. I'll not go into details. We have integrated approaches for health, safety, and well-being management. In other words, you must look at these HSW issues being integrated in management systems, into quality systems, environmental management systems, so that we build structures and procedures and ways of thinking that can enable organizations perform. Then, of course, the other issue is in terms of implementation and evaluation of interventions. So come up with interventions, try to implement these interventions, and also evaluate how effective these interventions are. Thirdly, we can try to embed health, safety, and well-being in strategic management. So at the time when you are developing your strategic plan, if you have health, safety, and welfare officers, maybe they have a department or they are under the HR department, they must work with the rest of the organizational members to come up with strategies. So we embed health, safety, and well-being in strategic management. The other thing that we can do is to integrate health, safety, and welfare into the planning and control cycle, and then performance measurement. So we come up with the performance measurement programs. Then we can also integrate health, safety, and well-being into workplace innovations. So in other words, you encourage innovations, and these innovations aim to create synergies between the parallel interest of health, safety, and well-being on one hand, and then good business and productivity at the other, so that you are able to integrate health, safety, well-being into workplace innovations, of course, dealing with issues of deploying people in order to improve performance with creating better quality of work. So that's also another way that you can actually achieve this. You can also integrate health, safety, and welfare into human resource management, including training and education. So you train every employee, you train the HR department, you also integrate health, safety, and well-being into human rights and corporate social responsibilities. You can also create a healthy and safe core processes and certainly good work. Now, of course, there are so many other things that we can do, ladies and gentlemen, and I do not really want to go into all those things, but at the end of the day, once this is done, we discover that results will be achieved. However, you need to note, ladies and gentlemen, that when you are mainstreaming these things that I have been talking about, there are challenges that you are bound to face. And these, what I call key mainstreaming challenges will include, for instance, one, getting health, safety, and well-being higher on the agenda of senior management. It's not very easy because they are not very familiar with this concept. The concept of health, safety, and well-being is alien to them. So having them discuss this issue is a serious challenge that you must be prepared to face. Two, developing greater involvement of business schools in developing approaches that generate double dividends may be a challenge. Therefore, you have to convince business schools that actually train, that develop human resources in this direction, so that they understand that if we talk about health, safety, and well-being, we are likely to have double dividends in terms of having good business, and two, also being good for health, safety, and well-being. And of course, another related challenge is to develop more strategic approaches for health, safety, and well-being, while the focus usually is on the operational risks, ladies and gentlemen. But do not forget that there's another important challenge you will face, and that is really tuning the dynamics of health, safety, and well-being management with the dynamics of organizational changes. So bring those two things together, right? Dynamics of health, safety, and well-being management with the dynamics of organizational changes. And of course, that will require to deal proactively with health, safety, and well-being, so that you develop an organizational culture that is conducive for health, safety, and well-being. of course, which will require health, safety, and well-being leadership, and that is a topic that we intend to cover later on after our next lecture. And then later on, the adoption and promotion of health, safety-related issues. Ladies and gentlemen, I want to thank you once again for coming and attending this lecture, which has been lecture 11, handling topic number 5, that is aligning perspectives and promoting sustainability. In this lecture, we have managed to introduce the concept of alignment and streamlining and promoting sustainability. We have also looked at the synergies that can be enhanced in policy and practice by putting forth the case for developing integrated and holistic approaches. And we have also dealt with the concept of aligning perspectives and maintaining health, safety, and well-being at the organizational level. And we have also looked at aligning perspectives and mainstreaming health, safety, and well-being at the social level. But again, in the interest of time, I think we did not really go very far in that perspective, but I must thank you. And right now, I can only say thank you very much for attending. Ladies and gentlemen, stay home, stay safe. I wish you a nice time, and let's meet next time, next week, in our next lecture 12. I wish you a nice morning, and I wish you a nice time. Let's meet then. Thank you very much. Bye.